All right. Hello, everybody. This is Antoinette Gentry Calloway, and I'm here for Foundation of Living, or I'm sorry, Foundation for Living, and I'm here with Kawana Tharps. We are going to be discussing the topic of being healthy physically and what that means to you overall. So, just a little background really quickly. Kawana, she's a nurse at a reputable hospital here in the surrounding area, and she's going to discuss the importance of having a healthy lifestyle and being in good physical health overall. So, Kawana, you can go ahead and take it away.
So just to introduce myself again, I'm Kawana. I am 29 years old, born and raised on the west side of Chicago. I've been a nurse for the past 5 years, primarily in critical care. So I started in the medical surgical ICU, and I spent the last 4 years working in the neonatal ICU, so with the mamas and babies. I am currently in school to be a family nurse practitioner, so outside of the hospital, more the primary care. I'm in school to be a family nurse practitioner at USC's Doctor of Nursing Practice program. It's a lot of alphabets and letters in this. But overall, my career goal is just to make an impact on Black health, basically improve Black health, whatever way that I can. And my goal is to do that with primary health care and kind of addressing racial health disparities. So that's my goal, and that's the background that I'm coming from, and I'm excited and honored that you asked me to do this.
Well, we're very happy and grateful that you were able to participate. And I like that our goals are aligned. Like we want to address those particular things that, of course, with, the racial disparities between the healthcare and health conditions of people of color and of Black people and marginalized people or people in marginalized communities. So we definitely want to make sure that we're able to address those needs. And we definitely need more people like you to show people that, yes, you can do it. Yes, you are able to do it and take care of yourselves. And that, you can become someone. Definitely put the respect on those additional letters that'll be after your name. So, yes, we appreciate it. So going right into the questions here, the first question we had for you was, or is, what are you most passionate about regarding being physically healthy? So first, if you can define what it means to you, and then going into your passion, we can take it from there.
What am I most passionate about being physically healthy? I'm gonna be a real disclaimer. They gave me these questions beforehand, but I still have to think about it.
Right.
I think physical health. It's kind of gets so my passion when it comes to physical health is really preventing illness and preventing illness and promoting wellness. So that kind of goes into like what I think it means to be physically healthy. I feel like a lot of people in the healthcare think of healthcare and think of sickness. Like you go to the doctor when you're sick, but a big part of the healthcare field is the primary healthcare field, which is what I'm going into, is wellness and preventing disease. So yes, a lot of money goes into the sick care. So yes, like there's a lot more money in like fixing a sick heart versus making sure a heart doesn't get sick. So my passion is really preventing illness. And I think a primary way to do that is through wellness. And wellness is what we're going to say. As cliche as it might sound, a big foundation of wellness is eating healthy and moving your body. So nutrition, exercise, getting some good sleep in, those are like big foundations of wellness. And I think it's important, again, I'm a healthcare provider, so clearly I'm going to say this, is working with a healthcare provider, a primary healthcare provider. So you don't just go to the doctor when you're sick. You go to the doctor for wellness checks. Like if you have insurance, you're covered for an annual wellness visit every year. And if you're a woman, you're also covered for a well women's exam every year. So go get those exams. So we can say, hey, you're on the right track, keep doing this. Oh, these numbers are a little off. Maybe you should adjust XYZ. So many disease processes that disproportionately affect Black people, but people in general, like the diabetes, like the heart disease, they can be largely prevented with proper nutrition and exercise. So I think it's very important that it's very important for physical health to establish that primary healthcare provider and to go. And so that you can also establish that relationship so that when things do go awry, if health issues do arise, you have someone who you built that relationship with that you feel like that can like guide you moving forward. So passion is wellness and preventing illness, but establish that care with your primary healthcare provider so they can help you when things go left.
All right, perfect. So the main takeaways are going to be that preventing illness is the number one thing, because if you prevent illness, I'm glad that you brought up the idea of money, because like you said, the money comes in fixing the sick heart. So after the damage is already done, we can put you on this prescription and you'll be on this prescription for the rest of your life. So that's money. You may need a surgery or two. So that's extra money. And then there are going to be specialists involved. So yeah, those bills can rack up. And whether you have insurance or not, at that time, once you become ill, it's necessary. So regardless of your financial standing, it can put you in a lot more or a lot worse of a position than if you were to actually take the time and go and use those benefits if you have them. And if you don't have them, at least, you can do some research. That's something that we want to be able to provide. If there's resources for like free clinics or free clinic visits or something like that, we want to be able to help guide people into the right path. And also that promoting wellness and wellness being based on nutrition. Nutrition is something that is a big deal, because you want to have fresh produce, you want to have, or even frozen produce or whatever is good, as long as what you're putting into your body isn't filled with the preservatives and the high salts and high sugar concentrations, so that you can keep your body balanced. So those are awesome, and they definitely do need some follow up to where people can understand how it does go hand in hand. All right, so let's see. The next question here then is, in your experience, are there any warnings that you wish to share with people so they can get the best care available to them?
Okay, so this is probably the part where I'm going to sound like a broken record. So first off, warning signs. Mm-hmm. There are if you are having difficulty breathing, if you have blood pouring from your body, if you are having the worst headache you've ever had in your life, if your heart is you have this crushing pain in your heart, or any of the signs of a heart attack or a stroke. So the paralysis, the loss of speech, if you're having any of that, those are huge warning signs. Go to the emergency room immediately. Those are late warning signs. So go to the emergency room immediately if you're having any of that. But overall, it's when we're talking about, so that's, you're going to rush to the emergency room so that you can get the best chance to live, right? But as far as getting the best care available to you, that's a little bit trickier, because I don't want to, I cannot and I will not, ignore all of the systemic barriers that go into racial minorities, marginalized communities not getting the best care available to them. So I think a big topic that's been in the media lately, which it should be, is the fact that Black women are 3 to 4 times more likely to die from pregnancy-related complications than white women. That's a problem. And that's a problem on many levels. And it's not that Black women are just naturally more inclined to die from pregnancy-related complications. No, it has to do with the care that we receive. And it's in the literature over and over again that they don't believe our symptoms. They don't believe that we're really in pain. And that's problematic, and that needs to be addressed at a systemic level. So I don't want to just put it on individuals, you need to do this so you can make sure you get the best care. That is a systemic problem that needs to be addressed in the healthcare field. But what you can do here is where the broken record comes into play. One, you need to advocate for yourself. So if you're at the doctor's office and they are explaining stuff, she's saying you need to be on this medicine, or we need to do this procedure, and they're explaining to you, and you're like, okay, and you have no clue what they said when they left the room. No, they need to explain it to you in a way that you can understand so that you can make an informed decision. So that's literally our job. We have to do that. And then that's part one of making sure you get the best care. So advocating for yourself, making sure you understand what these doctors, what these nurse practitioners, what whoever is trying to refer to you. But then the other bigger part of it is finding healthcare providers that you trust. That is so huge. Finding healthcare providers that will advocate for you. So, personal example, I had an IUD, an intrauterine device. It's a long-term contraception for people that don't know. And as much as I agree with the theoretical concept of it, it just was not working for my life. And I had a nurse midwife or a women's health nurse practitioner that I was working with. And for a year, we were just going back and forth, back and forth, back and forth. And she's just like, but it should work, and try this and try that. And it's just like, I'm a nurse. I'm educated. I know this. I know the background. I'm in the office crying. And I'm like, and then I'm mad at myself because I'm crying. It's like, what are you crying for? Long story short, like, I just felt like I wasn't being listened to. And so I got recommendations. My coworkers, again, I'm a nurse, so my coworkers are always asking for recommendations. I got a recommendation from my coworkers of a new obstetrician gynecologist to go to, Dr. Robbie McNair, Northwestern. She's great. And I love her. And it's like, so it might take some shopping around to do, but I feel like she listened to me. I feel like she advocates for me. My very first appointment, that lady knew so much about my life in a 30-minute time span because I felt I trusted her enough to tell her. And that's kind of what you want to look for. We on Facebook, on social media, we always ask for recommendations for our hair, for our nails, where to have this event, where to stay. If we go to Cancun, we ask for recommendations for that. We need to ask for recommendations for healthcare providers because, like, you want to know, like, do you have a gynecologist that you like? Okay, especially when it comes to like the women's health part and the having babies. Oh, I'm pregnant. I want to make sure I go to somebody who's going to advocate for me if anything goes wrong. So do that. And I'm actually still in the process of looking for a primary care provider. I've been a couple years and I went to one person. She wasn't bad, but it's just like it wasn't the vibe I was looking for. So I'm still looking. So find healthcare providers that you trust. Find healthcare providers that you trust.
Okay, awesome. So I like that because you want to make sure that you are in the position that trust goes back to making sure that you are able to ask the questions, because if you don't trust somebody, sometimes you might be intimidated or something. And that's why you don't ask the questions and you end up in a position where you're jeopardizing your health and, you're not getting all of the information that you need to make those informed decisions. So thank you. And then the systemic issues, that is definitely something that that's one of the goals. Like, we want to make sure that people are aware that we know that that's what's going on, but the part that you can do is this part. And then hopefully on the background, there are some things that we're able to do. Like you're going to be in the field and you'll be one of the better doctors, and then you'll be able to provide better care. And if we can get more people inspired to do that, then there'll be a better level of care available to people in the future. So thank you. Then the next question is, in your experience, is there a greater risk for babies to be born prematurely or with complications if the parents meet certain demographics?
Okay, so I work at Northwestern. I don't mind if you want to work at Northwestern.
Right.
This is a level 3 NICU. I've been there for 4 years now, and I've seen like the spectrum of everybody: young, old, rich, poor, every race and ethnicity you can think of. So no one is immune to premature labor and premature birth, right? But there are risk factors that put you at a greater risk of having a premature labor. Some of them are like, if you're young, particularly under 18, but also under 24 years old, if you have a history of a premature birth, if you have less than 18 months between pregnancies, if you're smoking or drinking or taking any other substances during pregnancy. I think there's another major one. Can't think of it. But also if you have any like pregnancy complications that necessitate them induce your labor to protect your health and baby's health. And the biggest one that I can think of is like preeclampsia, or the high blood pressure. That can get to a certain level where it is dangerous for the pregnancy to continue. So they rather induce your labor to save both of your lives. So those are the biggest risk factors. All that being said, statistically, Black women have a 50% higher rate of preterm births than non-Hispanic or Hispanic white women. So again, this is not saying that Black women, something innately in Black women means they're having preterm babies. No, that's not the thing. Being Black itself is not a risk factor. But if I look at the Austin, so it's again, those systemic barriers that we have that's in play. But also, if you look at the Austin community, and I bring up the Austin community, one, because that's where I was born and raised. Two, because I've researched it for school purposes, so I'm a little bit more familiar with it. And it's a predominantly Black community. It's about 80% Black, and it's the largest geographic neighborhood in the city of Chicago. So I'm using that as a reference point for my comfort. But so if you look at the Austin community, and you can go on Chicago Health Atlas and see this data, not Black women, residents in the Austin neighborhood, they smoke during pregnancy at higher rates. They have lower early prenatal visits, like prenatal visits in the first trimester, compared to the city. They have lower rates, but they also, again, the systemic side of it, have less access to adequate prenatal care. So you have to look at both sides of that. It's like, yes, there might be increase in risky behavior, but there's also like decreased access to the care that is required. So what I would say to mamas, pregnant mamas, and mamas who want to be pregnant, clearly do the thing, like avoid the things that you can. So don't drink during pregnancy, don't smoke during pregnancy, don't pop pills, do whatever. Don't do any of that. Don't do anything that will unnecessarily put your health at risk. So that's number one. And also start your prenatal visits early and go regularly. So neither one of these things will stop you. Don't completely eliminate the risk of you having a preterm life, because you can do all of these things and still have a preterm birth, unfortunately. But it eliminates the risk that you can control, and it puts a healthcare provider on your team to monitor for any of those complications that can arise. So that's kind of my take on that.
Okay. So it's the making sure that, because again, the systemic things, we can't really do much about that at this time, but with the things that you do have control over, make sure to mitigate your exposure to risk, to those risk factors. Okay. And then
go to the doctor.
Yes, go to the doctor, go to the doctor, go to the doctor. And then one of the other questions, or the next question, is, does stress have an impact on a person's physical health? And if so, can you describe what type of impact it has?
Okay, so short answer is yes. Long answer is yes, but it's not as simple. It's more complicated than like, oh, if you're stressed out, you're gonna have a heart attack. It's not that simple. So stress affects hormones in the body, primarily adrenaline and cortisol. And these hormones, like, they mediate a bunch of different processes in your body. So a big thing with adrenaline, like in the short term, like short-term stress, short-term activation of these hormones is good for us. So like if we're in danger, the fight or flight that we learned about in high school biology, it helps you be better equipped to run away, to escape from an enemy. Or let's say you cut yourself and you're bleeding, it's gonna make your heart pump faster so it can deliver oxygenated blood to your organs while you're losing blood. So these are good in the short term. In the long term, with chronic stress, they can have negative impacts on your body. Some of them, like just as simple as like muscle aches and pains. It can affect, so with the heart attack example, chronic stress can raise your blood pressure because that's part of the fight or flight response. It can raise your blood pressure, but chronic elevation of blood pressure, hypertension, can increase your risk of having a heart attack or of having a stroke. So yes, stress can affect your risk of having a heart attack or a stroke. In men, it affects sex hormones. So in men, it affects testosterone, and it can cause erectile dysfunction. In women, it can cause menstrual irregularities. So yes, stress can affect your physical health. It can also affect your mental health. I know we're doing physical health today, but chronic stress leads to anxiety, depression, chronic fatigue, and that's part of our overall health. So I literally remind myself every day, and this is my reminder to anybody else who is listening, like avoidance of stress, self-care and avoidance of unnecessary stress is required. It's not selfish. It's like literally required for your health. So take time to practice self-care and avoid unnecessary stress because it does impact your physical and mental health.
Okay. And then for those self-care things, that could be something as simple as, going to get a manicure or pedicure, or I'm just going to go for a drive, or I'm going to go for a ride, or, just get away from whatever it is that's causing you those stresses and causing um, the anxiety and things like that. So that is definitely, and it goes back with the overall wellness, like you said. So self-care is a part of taking care of yourself. It's a preventative measure. It's reducing the stress. And then hopefully another part of the self-care would be maybe you can indulge or something like that on something that you might not eat regularly, or that you might have to go a little further to get, since if someone's living in like a food desert or something like that. And then it looks like the other question, or actually the last question is, in your opinion, what are some steps or measures that Black people and others in marginalized communities can take to improve their overall health? Which is kind of one of the other questions, but a little bit more detailed.
Okay. 3 things I can think of. On the individual level, first off, eat more fruits and vegetables. Eat more fruits, vegetables, and whole unprocessed foods. Like, that's number one. To improve your health, that's like number one thing you can do. And when I say incorporate this into your diet, and when I say diet, I don't mean like, oh, I'm eating this way to lose weight. I mean, what you're eating every day. Incorporate more fruits, vegetables, and whole unprocessed foods. That's number one. Number 2, move more. Again, very basic, like nutrition, physical activity. Move more. This doesn't mean go get a gym membership and like pound yourself in the gym 3, 4, 5, 6 times a week. It can be whatever you want it to be. You can go for a walk. You can go for a run. If you like to play basketball, if you like to play tennis, if you like to play golf. My family has lived in the Austin community for over 20 years. And I literally just found out last year when I was doing research on the Austin community that there's a whole golf course in the Austin community at Columbus Park. And I never knew that. I never knew that until last year. But I'm saying that to say, like, whatever it is that you like to do, dancing, running, walking, whatever, do that. Move more. It's really more important what you do in like the majority of your day, not just what you do for an hour in the gym. So those are the 2 things that I would say you can do on an individual level. If there's no like magic pill, like, oh, drink sea moss gel or drink green juices, or it's simple. Nutrition, move more. Those are 2 things. But the third thing, because I can never ignore systemic stuff. The third thing is appeal to your elected officials, like your aldermen, your councilmen, your mayors, to get what you need to be healthy in your community. Austin is a food desert. Austin is the largest geographic. It used to be the largest by population too, but people moving. The largest geographic neighborhood in Chicago, but yet it's a food desert. There are a couple grocery stores that I don't go to because the produce is trash, for a better way. Just like, so it's really appealing to your account so they can bring, like, that, again, it's their job, so they can bring grocery stores that have fresh produce at reasonable prices that's not half spoiled to your community so that you have access to it. You don't have to travel to Oak Park or wherever else you go to get your groceries. And as far as the moving and getting parks, we have parks. There are so many, and again, I'm using Austin as a reference point. There are parks in Austin, but are they well maintained? Are they equipped? Are they well lit? And most importantly, are they safe? Do I feel comfortable going to La Follette Park at 6 a.m. for a walk, or at 8 p.m. at night for a nap? Do I feel safe enough doing that? So refresher, 3 things: eat more healthy foods, like fruits, vegetables, whole unprocessed foods, move more, but appeal to your elected officials so they can make sure you have the resources in your community to do those first 2 things. So I think that would greatly affect our communities, the health of our communities.
Right. Oh, no, thank you. I appreciate you bringing up that point of actually appealing to your elected officials. There is a different organization, and they've done like a 5-year plan, and they separated into different sections, and one of the sections was about political involvement. So they were showing uh, like how many people voted in the most recent mayoral election, that it was like the lowest turnout, and there were a lot of things there that were, you can understand how, you can't understand because nothing allows it, or nothing should make it okay for the situation to be as it is, because as an elected official you're still responsible for representing the area, and if nobody is coming to you, you should be proactive enough to go out and identify the needs, and if those needs are incorrect, then that can spark the people to come to you and say, well, that wasn't necessarily what we wanted, but you should still be doing something anyway. So I did want to make that clear. But yeah, so they definitely listed in the section when they did discuss political involvement, it did show that there was quite a lack. So that's something that, hopefully on the back end, as more people get to discuss things and bring things up, hopefully they'll do more encouraging of, getting involved. And being involved also means that you can be the actual representative, that you can run for somebody, run for somebody's seat, that you can try to change things by you being the change. So that's definitely something that I want people to receive out of these communications. So thank you. And then I know we didn't have any other questions listed for you, but you are, frontline, you are, working amidst all this COVID stuff or anything like that. I know you hear it all day, every day, but did you have any things, or, if you got a second for a soapbox moment where you can go ahead and get your point across and how you feel about it and how it's being handled and what people can do to protect themselves and others, because that's a big part of it as well. You can take the floor for that, and then once you're finished, we can just wrap up.
Oh, goodness. This one I was not prepared for. Right, and it's just like, probably start avoiding unnecessary gatherings. If you're going to gather, keep them small, still keep those precautions in place with wearing masks. Of course, the vaccine is out now. I got it. I got my second dose on Friday. I shared my experience on my Facebook, on my on my Instagram and my Facebook. I was very fortunate the first time I got the Pfizer dose. I got it the first dose on December 18th. The only side effect that I experienced was a sore arm. 3 weeks later, I got the second dose this past Friday. Again, only side effect I experienced was a sore arm. Super, super happy about that, because it's also very possible to have, and again, this does not mean they did not give you COVID and you are not sick, but you can have some of the common side effects are headache, fatigue, chills, fevers, muscle aches, and of course the soreness at the injection site soreness. So those are very possible. And if you get any of those, it might disrupt your day, but it shouldn't last more than 72 hours, 48 to 72 hours, and then that's over. I think my sore arm, the second go round, might have lasted a little bit longer, but that was it. I know a lot of people in our community are, not just our community, I won't even put that on us. A lot of people in general are very hesitant of vaccines and how fast this came about. The research is out there, the science is out there. Talk to a healthcare professional if you have questions. Don't try to avoid going to social media and asking people who don't know like that background. Now, it's very valid to have questions. I was one of those people, I believe in science and I understand like the mRNA vaccine and how it works. And I was like, I'm probably gonna wait to the second go round of vaccines. But then I decided to get it. I decided to get it this go round with some encouragement from my mentor. But and it's fine. So like if you have questions, that's valid. Have questions, ask. Just like I was saying, make sure you're informed about what you're doing. Don't make judgments based on what you see on social media. Or are very like slanted news who's only reporting, oh, there's one person out of 10,000 people had this side effect. And it's like, okay, like, yes, we want to know that those exist, but at the same time, like talk to a healthcare professional if you have like questions about how this relates to you. In the meantime, if you don't want to get the vaccine, you are not required to get the vaccine. Don't get it. Wash your hands. Stay away from people. Like you can't have it both ways. I'm not going to get the vaccine, but I'm also not going to wear my mask and wash my hands and stay away from people. We want this to be over. We're all working together. do your part, whatever it is you're comfortable doing. At the minimum, wearing a mask and washing your hands. And that's where I'll stop.
Thank you. Thank you. Yes, definitely. I'm glad that you didn't have any of the crazy, feeling bad or anything like that with your second dose, because I think that was the expectation, not expectation, but that's what most people were reporting, that the second dose was going to be when you would like feel a little woozy or ill or something for a couple of days, but then you still, be able to proceed from there.
Yes. Especially with because that's like, and again, if you decide to get the vaccine and this happens to you, that's all within expected, because your body is a mounting immune response. That's what your body is supposed to do. Like when you have the flu and you feel bad, it's because your body's mounting an immune response. Same thing, but they're not giving you COVID, they're not giving you a virus. It's just like okay, this is my body doing what it's supposed to do to make these antibodies. So it's expected. It might suck for a day or two,
but it's okay.
Yes.
All right. Well, I want to say thank you again. I really do appreciate your time, of course, and you giving us all of your expertise and sharing your knowledge with us.